And now let us discuss about the next topic in head and neck, guys, that is the anterior triangle of the neck. So anterior triangle of the neck, it is in turn further divided into like 4 triangles, and all those 4 triangles we need to learn their boundaries and their contents and their the roof and floor and everything. So we'll do that individually, separately. But first of all, we'll see the main boundaries of the anterior triangle, like what is the complete anterior triangle bounded by, and then we'll see the subdivision first. So first our main focus will be to understanding all the 4 triangles and their boundaries. So first of all, the anterior triangle of the neck, just look at the diagram on the screen here, guys. The diagram is like we are showing the anterior triangle from the front here, and with this head lifted here a little bit. So this is how the triangle looks like. Now in this diagram, first of all, this will be the midline of the neck here. This is the midline here. So midline of the neck over here like this. And then on the other side it is bounded by sternocleidomastoid muscle here like this. And then there will be mandible present here. So between these three, you will be actually having your anterior triangle of the neck. So the anterior triangle of neck is basically between the midline of the neck. This is the midline of the neck. And then this will be the sternocleidomastoid muscle over here. And then this here will be the mandible. This is actually the boundaries of complete anterior triangle of the neck. Now after that, this anterior triangle is in turn further divided into 4 triangles. Let us see all those 4 triangles one by one. Now in this diagram, first of all, you are able to appreciate the anterior belly of digastric over here, and then that will be actually continuing behind as the posterior belly of digastric here. Just to appreciate in the diagram here, so there will be anterior belly of digastric here, and then there will be the posterior belly of digastric over here. Now between this anterior belly of the digastric and the posterior belly of digastric and the mandible on the other side, you are able to appreciate this triangle, and that will be the digastric triangle. And the same digastric triangle is present below the mandible there, also known as submandibular or digastric triangle. Next one. The next one will be very much simple here. There will be anterior belly of digastric on one side, symmetrically it should be there on the other side also. Now between these two anterior belly of digastric and the hyoid bone over here, there will be one more triangle here. Between the anterior belly of digastric on either side and this hyoid bone below here, yes, between them this triangle here will be the submental triangle, and that is one triangle which is unpaired. It's only a single triangle, it is not like paired. Remaining all the triangles that we are able to see here will be the paired ones. Perfectly done. Now after completing the boundaries of these two triangles, guys, don't worry, like I'm going to make you people draw even this diagram also. This entire diagram we are going to draw, so don't worry about that. Just focus on the screen, look at the diagram, try to get it printed in your mind. Okay, and now welcome to the most important one, posterior belly of digastric here. Okay, and this one will be the superior belly of omohyoid. Superior belly of omohyoid, and this here will be the sternocleidomastoid. So between the posterior belly of digastric and the superior belly of omohyoid and sternocleidomastoid, that triangle will be the most important one, that is carotid triangle. And the last and final one, yes, between this midline of the neck, okay, and then here the sternocleidomastoid muscle and the superior belly of digastric, this one here will be the muscular triangle. That will be the muscular triangle, guys. So basically the anterior triangle of the neck will be in turn divided into like 4 triangles. I'll just tell you the names once more and then we'll start drawing our diagram. So this one here, number 1, digastric triangle, also known as submandibular. Number 2, this one here will be the submental triangle. And number 3 here, the most important one, carotid triangle. And finally number 4 here will be the muscular triangle. And now let us draw this entire diagram, guys. Exactly as it is shown here, let's draw this diagram here. So first of all, write down the heading there, anterior triangle of neck. Let us discuss about the anterior triangle of the neck in detail, and first we'll see the boundaries and the subdivisions of that. Now in the anterior triangle of the neck, first imagine this one here to be the mandible. I'm going to draw the same diagram, guys, like the diagram that we have seen just now, with the head lifted little bit above like this here. So we are seeing the anterior triangle. And somewhere here you'll be actually able to see the mastoid process here, guys. So imagine this one here to be the mastoid process. Perfect. Then somewhere here this one will be the hyoid bone. This will be the hyoid bone in the middle here. Then below here, you just draw the diagram of sternum. So imagine this one to be the mandibular sternum here. That will continue down to the body of the sternum. And like important thing, the bone which will come and join here, imagine this one to be your clavicle. The clavicle here guys, on either side. Perfect. That's the arrangement over here, the mandible and the hyoid bone over here, and then you'll be actually having the mandibular sternum and the clavicle over there. Now first of all, let us deal with the digastric muscles guys, that is the anterior belly of digastric and the posterior belly of digastric. Now there will be anterior belly of digastric from here, the chin region, and then there will be a tendon in the middle, and that tendon will be actually passing through a pulley. We are going to see that pulley also, don't worry about that. And then the posterior belly will go and join here with the mastoid process. That is the posterior belly of digastric. Similarly, if I draw on the other side also, the anterior belly of digastric, and then this will be the posterior belly of digastric over here. Perfectly done. Now they are going to pass through a pulley here, tendinous pulley, which will be actually attached to your hyoid bone here. So let me just write down the name here. What is the name of this muscle guys? This one will be anterior belly of digastric, and this one here will be the posterior belly of digastric. I am just writing in short there. I hope you will be able to manage. Anterior belly of digastric and the posterior belly of digastric. So we are done with this part, basically this part, crystal clearly. Now after that, the very famous one and the very important one when you are studying about the triangles of the neck, that muscle will be the sternocleidomastoid muscle. So sternocleidomastoid will be actually having like two heads of origin. So one will be the sternal head, another one will be the clavicular head. So similarly on the other side also, the sternocleidomastoid will be actually having like two heads of origin. So one will be the sternal head and another one will be the clavicular head over here guys. That is sternocleidomastoid muscle. Now just to complete this guys, let me just write down the name also inside that. So this is sternocleidomastoid. Sternocleidomastoid muscle on either side. Now what is the muscle present behind here posteriorly? That is your trapezius muscle. So imagine here my dear friends, this one will be the trapezius muscle over here. So that one will be the trapezius muscle there. Similarly on the other side also, yes, we do have a trapezius muscle here guys. So imagine this one to be the trapezius muscle. Now let me include the omohyoid muscle here so that everything will become like crystal clear here my dear friends. Omohyoid will actually have like two bellies. One will be superior belly of omohyoid, there will be superior belly of omohyoid, and then there will be inferior belly. So superior belly of omohyoid will be somewhere over here, and then this one here will be the inferior belly of omohyoid. So superior belly and the inferior belly of omohyoids. Perfect. And similarly the superior belly of omohyoid, and then somewhere here will be actually having the inferior belly of omohyoid. So in this manner, it is exactly the same diagram that we have seen just now, lifting the head above, and we are actually able to see the anterior triangle of the neck. So in this anterior triangle of the neck, let us first of all see the subdivisions of all these triangles guys. So imagine here, this is exactly the midline of the neck. This is the midline of the neck over here. So if that is the midline here, you are able to see on one side the complete complete anterior triangle of the neck, and each anterior triangle of the neck will be divided into four triangles. Number one, anterior belly of digastric, and then the posterior belly of digastric and the mandible on the other side. This triangle, I'll just give the number as number 1 here, and this number 1 will be the digastric triangle. Digastric triangle, and it is present below the mandible, so therefore it is also known as the submandibular triangle. Submandibular triangle, digastric or submandibular. Now similarly, the next one and the most important one, between the posterior belly of digastric and the superior belly of omohyoid and the sternocleidomastoid muscle on the other side. Now this triangle number 2, that is very important guys, it is the carotid triangle. That is the carotid triangle. So the carotid triangle is between the posterior belly of digastric, the superior belly of omohyoid and the sternocleidomastoid. If we have not written the name, let us write down here. This is superior belly of omohyoid. and this one here will be the inferior belly of omohyoid. Perfect. And now this triangle, like on one side will be actually having the anterior belly of digastric. Similarly, we also have one on the other side also anterior belly of digastric, and then this hyoid bone here, and this is the triangle number 3, and this triangle number 3 here will be the submental triangle. That is submental triangle here. Perfect. And the last and final one here, guys, that is between the midline of the neck, and then on the other side will be actually having the superior belly of omohyoid and the sternocleidomastoid. This is number 4 here, and that will be the muscular triangle. So in short, we can say that the entire anterior triangle of the neck will be divided into 4 triangles there: digastric, carotid, and the submental triangle, and the muscular triangle. They are like 4 triangles here. Now, out of these 4 triangles, I would like to tell you one thing here. Boundaries are done. We don't have to repeat the boundaries like again and again. Now, out of these 4 triangles, the most important thing is, let us finish off 2 of them here itself. That is your submental triangle and muscular triangle. We don't have to learn them separately again. Why? Because these are the easiest one. Not only that, like not even like many questions are asked from here. Submental triangle, we are already confirmed with the boundaries. In the diagram, you can see the boundaries very clearly. Anterior belly of digastric, and there is a hyoid bone over here, and this triangle below is submental triangle. And submental triangle will just have lymph nodes. The content of that is, what is the content of submental triangle, guys? It will just have submental lymph nodes. That's all. That's the reason why I'm telling you it's not even that much important here. It is not even being asked in the exam. So boundaries we are done comfortably with the diagram, guys, and then contents is just the lymph nodes present there, submental lymph nodes. Similarly, about the muscular triangle, we are done with the boundaries already. Midline of the neck, the sternocleidomastoid, and the superior belly of omohyoid. That is a muscular triangle. And in the muscular triangle, what will be the content of this one here? It will just have those strap muscles here. One is sternothyroid muscle, another one is sternohyoid muscle. So one will be the sternothyroid muscle, and another one will be the sternohyoid muscle. So these 2 strap muscles are actually present in the muscular triangle. Muscular triangle will have these 2, sternothyroid, sternohyoid. Done. So that's the reason why I'm telling you these 2 triangles are done here itself. Now after completing this one, let's actually go towards the carotid triangle and digastric triangle and learn about them in detail. Okay. And please don't try to forget the boundaries here, guys. The carotid triangle is between the posterior belly of digastric, the superior belly of omohyoid, and the sternocleidomastoid. That's your carotid triangle, very important one, and the digastric triangle over here. These 2 triangles we got to learn in detail. Submental muscular, easy, don't waste most of your time over there. So learn a lot regarding the carotid triangle and digastric triangle in detail. So now let us move towards the carotid triangle right now, guys.